thenttledentist.com. We're located in Shelby Township, Michigan, and our phone number is 586-247-3500. Today I'd like to discuss with you a major problem that affects over 40 million Americans throughout the country. It's called obstructive sleep apnea. Maybe you even have a partner or a spouse who has an issue where they snore and they stop breathing for a while. That's called obstructive sleep apnea. And it's something that really affects the national health of a lot of people. High blood pressure, stroke, diabetes, and there are a number of different medical conditions that are secondary to this problem. This problem is usually, if you've heard of somebody, normally they'll be treated with what's called a CPAP machine, which is a device that goes over your face. It's like a mask, wearing a mask, and it puts pressure, positive pressure, into your mouth, into your throat, and down into your lungs, and that then will give you adequate ventilation so that it kind of keeps your airway open. I would like to use one of our tools that we have at our office, a video that we have that for patient education, and it does a really good job with explaining that, and then soon after that I'll discuss with you a little bit more about this serious problem of called.
Many people suffer from problem breathing during sleep, ranging from mild snoring to a dangerous condition called obstructive sleep apnea. Snoring is the sound made by the vibration of the soft tissues in the mouth and throat. This happens when you're asleep, and the tongue, soft palate, and lower jaw relax and narrow your airway. This increases the speed of the air flowing through your airway and causes the soft tissues to vibrate. On the other end of the scale is obstructive sleep apnea, which causes sufferers to stop breathing periodically during sleep. The soft tissues collapse against the back of the throat, cutting off the airway for 10 seconds or more. The lack of oxygen forces you to partially awaken in order to open your airway, often with a loud gasp. The cycle then repeats many times every night, sometimes up to 40 times an hour. Some of the most common symptoms of obstructive sleep apnea include loud snoring, gasping or jerking during sleep, headache and sore throat, confusion upon wakening, excessive sleepiness during the day, difficulty concentrating, irritability or depression, and cardiovascular problems such as high blood pressure, stroke, heart attack, and congestive heart failure. There are several simple actions that can help you stop snoring: losing weight, avoiding alcohol, sleeping on your side, and using a humidifier. If we suspect that you suffer from sleep apnea, we'll recommend that you see your physician as soon as possible for a complete diagnosis. One of the most common treatments for snoring and sleep apnea is a customized oral appliance. These hold the lower jaw forward and keep the airway clear. To make a custom oral appliance, we'll first take impressions and bite registrations of your teeth. From these records, precise working models of your teeth are made, and the models are used to create an appliance specific to your needs. Some oral appliances are made in our office, while others are made in a dental laboratory. When the appliance is ready, we check the fit and make any necessary adjustments. For the first few nights, put it in 15 minutes before sleep to help your mouth get used to the appliance. Some initial soreness is normal, but let us know if the appliance is otherwise uncomfortable so we can adjust the fit. Identifying and treating your nighttime breathing problems can help restore your sleep and maintain your health.
So what they didn't discuss in that video was the primary treatment, which is the CPAP machine like I was describing. But a lot of people are not really accustomed to that, and it becomes very cumbersome and quite uncomfortable to use. That's why the oral appliances work so well. Something like this, they just, it comes right out of the mouth, and at nighttime you just put it in like I described. It keeps the lower jaw pushed forward. When you push your lower jaw goods forward, it opens up the airway, and you can breathe through your nose and through your mouth, and it prevents the collapse of all that soft tissue into the space. So if you have any questions, I'll be more than happy to answer them. My email address is drantolak@thegentledentist.com. I'll be more than happy to answer them. Also, our email address, our website is thegentledentist.com.